It is my great pleasure to introduce you to Dr. Ciara Zachary. Dr. Zachary is a faculty member at the UNC Gilling School of Global Public Health. Her previous experiences as a health policy analyst at the North Carolina Justice Center and as a health program director for NC Child, which is a statewide advocacy organization. Ciara earned her undergraduate degree from the University of Pennsylvania, an MPH from the University of North Carolina at Chapel Hill, and a doctorate from the Johns Hopkins School of Public Health. She's worked closely with members of our North Carolina League who know her to be an outstanding ally with a talent for untangling the complex language of healthcare policy. As you are about to learn, Ciara is just the right person to address this caucus. The analysis she will share with us is based on her very deep understanding of the intersection between health and every aspect of the environment in which we live, work, and play. Her informed insights combined with her great ability to hear the stories of those most affected by the dysfunction in our current healthcare system make her eminently qualified to begin our conversation tonight, and we're very grateful that she's here. As you listen to Ciara discuss the freedom of health, which is the title of her comments, some of you will recognize a connection to some of what was expressed last weekend in the Poor People's Moral March on Washington, led by our fellow North Carolinian, Dr. William Barber, and sponsored along with other notable organizations by our very own National League of Women Voters. And so it is especially fitting that Ciara is here to help us realize the moral imperative of healthcare reform, described just last weekend as needed, quote, in the fierce urgency of now. I am proud and indeed honored to give you Dr. Ciara Zachary.
Thank you so much for having me. And I am sharing my screen now. So yeah, just to start, thank you so much to the League for inviting me to speak with you. And I also just want to thank Robin for your partnership and collaboration on the many healthcare policy campaigns that we've worked together on over the years. So moving forward. My presentation tonight is entitled Freedom to be Healthy. And to better understand my views on health policy and health reform, I guess I just really want to share my story. How did my hometown, my upbringing, educational experience, and work experience shape the work that I do today? And my feelings about how access to healthcare is a key step towards freedom. And with freedom, I mean freedom for kids to grow up and reach their full potential to thrive, freedom for Black women not to live in fear about maternal mortality, freedom for older adults not to feel that they have to spend down their assets so that they can qualify for Medicaid, and freedom for part-time workers not to worry about whether they can afford to purchase health insurance because their employer doesn't offer it. And so with this presentation, we'll just go through these little steps of just a background of who I am. How did I get into health policy research and advocacy? How did I really come to understand healthcare reform, and why I believe that we have a great opportunity to increase single payer support. So who am I? Besides Robin's lovely introduction, I truly believe that growing up in Baltimore really shaped my understanding of disparities. So the picture of on the left is the beautiful Inner Harbor, where Baltimore really lives up to its reputation as Charm City. However, not too far away, and you can see some of those high-rise buildings in the background in the picture on the right, you see low income, low rises. You may be familiar with the television show The Wire. And these parts of the city are not that far away from one another. Growing up, I was really lucky to have a middle-class background. My parents had state and federal government jobs, which meant that, they had access to decent benefits. However, it doesn't mean that I wasn't exposed or didn't know that some folks really struggled with some of the basic things that we had. And then later, at an early age, pretty early age, maybe middle school, I realized that there were folks who had way more access to other benefits and lived more comfortably once I started attending a private school that was a predominantly white educational institution. And I remember conversations that my parents would have saying that they were making financial sacrifices to send me to this school, but knew that, getting a better education may mean that I could go to better colleges and get a better job and live more comfortably than, we did. And so I just think with all these things, it just kind of a lot of questions growing up and thinking like, why are there these differences and what can be done to address the disparities that people experience? So, in my position as a faculty member, I actually get to mentor students. And just today, I spoke with a student, and I was like, "So, why are you into health policy?" And she kind of had the same response as me, saying, "Hey, I thought that one way to really change health outcomes and health behaviors was to become a medical provider or a clinician." And I kind of figured out what public health was, and that there are ways to influence health behaviors and health outcomes. So, the image that you see on this slide is the socio-ecological framework or model. And this model really showed me that there are lots of levels to address health outcomes and health behaviors. And for me, what was so enlightening was just understanding that policy is such a great lever to really shift the curve and to move not just individuals, but communities and just entire populations. I also had really great work experiences working in program evaluation with American Indian Alaska Native tribes and about injury prevention and how to evaluate their programs to inform tribal policy. I worked at the North Carolina Justice Center as an analyst and did a lot of community education and outreach. And even my work as a policy director on projects that worked on environmental health and even oral health. And what all of this has, kind of taught me is that no matter what part of the country you live in, what hobbies you like to do on the weekend, many people really want a freedom to be healthy. They want to know that they have access to healthcare and that they want their children to be healthy and their family members and their loved ones. And so, how did I kind of come to, understanding health reform and actually start turning the curve into becoming a policy advocate? And I would really have to say it's interesting that we're speaking today and that this is the 10th anniversary or the 10th birthday for the Affordable Care Act. I remember sitting in classrooms in graduate school and professors just kind of saying, we're not going to go by the syllabus today because this is what's happening in healthcare. And this is actually like transformative moment, and having discussions about what would, ultimate or transformative healthcare reform look like. And at that time, when there was, little chats about there possibly being a public option in the Affordable Care Act, and thinking, for the first time hearing this, this term single payer and how a public option could be a pathway to single payer. But as we all know, the Affordable Care Act did not end up having a public option. And then since, the enactment of the Affordable Care Act in 2010, it has experienced a lot of, litigation and has really been shaped by court decisions. One thing that has really maybe weakened the Affordable Care Act is that, Medicaid expansion was made optional. And that, again, while maybe more people have greater access to affordable healthcare, it still leaves way too many people underinsured and uninsured. So how did I kind of come even more to understand and supporting single payer? Despite the fact that the Affordable Care Act is the law of the land, I think we have seen lots of attacks on this law. Even though 53% of Americans say that they would view the Affordable Care Act favorably, that's not a strong majority. And there are still court cases. There are still attempts to weaken the Affordable Care Act and Medicaid. And so in some ways I say that this law has been left to wither on the vine, even though, like, just think a few hours ago, I was on Twitter and saw that the US House Dems are introducing, I guess, quote unquote, an ACA 2. So, people are aspiring to strengthen and maybe the law. But despite, all the work to protect the Affordable Care Act and to promote Medicaid expansion, I feel that some of my work in communities, whether it be community forums or webinars, people still have questions about why isn't healthcare still affordable? Why do they pay so much for prescription drugs? And even this is happening in various states across the country. And I think there are, advocates who want to understand policy a bit more and how can we go a step further, in my experience here in North Carolina. So this kind of gets me to why I feel that today and this moment, this year is really an opportunity for us as policy advocates to increase support for single payer. And, I don't think any of us are living under rocks right now and have heard about the United States is experiencing two pandemics. The first, I would say, is COVID-19. And the second is the United States is, kind of having a reckoning with its history with racism. So in regards to COVID-19, I do spend time on Twitter, and maybe I'm a little bit selective in who I follow on Twitter, but it seems that a conversation is shifting. People are, talking about essential workers, and these just aren't people in the healthcare industry. People are recognizing that, childcare providers, bus drivers, people that work in meat packaging places, grocery store workers, and delivery services people are essential workers. And folks are kind of tying, making that link that essential workers oftentimes lack the benefits for paid sick leave and even access to affordable and quality health care, and still putting themselves at risk by going to work. And so I think people are saying that there is a disconnect, and that maybe employee-sponsored insurance isn't the best route. On top of that, I think the COVID-19 pandemic has really exposed the economic fragility in the United States. We are seeing lots of projections about employment levels and how many people are losing their jobs and turning to the marketplace or relying on Medicaid to try to get healthcare. We've also had Congress act quickly with the Families First Coronavirus Response Act and even the CARES Act. While, I think these were great steps, they aren't, for the long term. And a lot of these, and these acts also don't go far enough for the supports that people need. And I also think, with the action that Congress has taken, should hopefully be evidence to people that transformative health reform isn't just a pie in the sky aspiration. We can apply pressure to our political leaders and our lawmakers to make change quickly to address healthcare needs. And I think the COVID-19 pandemic is really exposing how great of need people have and how, access to care even before COVID-19 has impacted the health outcomes of folks currently. And that gets me to this slide, is that COVID-19 is also making people very much aware of health disparities. We are especially seeing disproportionate impacts on Latinx communities and the Black community. The Centers for Disease Control and Prevention have noted that a lot of reasons for racial and ethnic groups experiencing these disproportionate outcomes is because of the work environment and lack of benefits like paid sick leave, where they live and their access to amenities, and also health inequities like access to healthcare. And so that kind of links, nicely to racism in public health. We are noticing that states and lawmakers are recognizing that racism is a public health emergency. States are trying to figure out ways to address these systemic issues that leave some more people vulnerable to COVID-19. And I think nothing really kind of displays that link more so than, George Floyd, which may have sparked, the protests and the uprisings that we are seeing across the country, but the fact that he also tested positive for COVID. And on this slide, I have notes about the gardener's tale, and that's from Dr. Camara Jones. I really enjoy her work. And she talks about various levels of racism and how that impacts, people's perspectives. So there's institutionalized, there's personally mediated, but then also this gardener who's planting these seeds and the way he treats them, the seeds and the crops impacts how they view themselves and their behaviors. And so how all these levels of racism are connected and might, influence health outcomes. And so then, Dr. Kamara Jones also talks about addressing social determinants of health, which many of us recognize, like where we live, we play, we worship, and where we learn. But she also says there are determinants of equity and thinking about racism, thinking about our social norms in our country. Like, why do we feel that you have to work in order to have health care, or that, having access to, safe and drinkable water or food or secure housing is something that people have to prove that they deserve. And noticing, that these policies actually shape outcomes for folks. And so I think, many of us might have seen kind of an illustration that's on this slide showing equality versus equity. And that, if we notice that their policy is one determinant of equity, why not transformative healthcare reform? That could be one policy that can address racism, and why, historically some racial and ethnic groups do not have access to healthcare. And it can also, help shift the curve and really help people feel like they are free, they have freedom from fearing that they will go into medical debt, freedom from fearing that they will, get COVID-19 and be stressed with their families. So I think that when we address social determinants of health, when we address determinants of equity through maybe some transformative health care policy, then we can really start thinking about social justice and true equity for everyone in this country. So I will actually wrap there. Thank you again so much for your time and for inviting me. And I, appreciate this moment, and I look forward to your questions.